All right, so this is the Board of Health meeting, January 12th, 2022 at 12:30 p.m. And we are located at 18 Mulberry Street for an in-person and Zoom meeting. This meeting can be accessed using meeting ID number 863-9978-9686 with a passcode of 271193. The meeting is also accessible via phone 1-646-876-9923. And if people have any problems with either their audio or accessing Zoom, they need to dial 603-821-2049. And we're doing the meeting in person and on Zoom in order to protect the health of everyone involved that would participate in the meeting, but it is accessible by on-site at 18 Mulberry Street.
Thank you. Because this is a new term, we need to have the doctor sworn in. And I see Attorney Bolton is here. Steve, balls in your court.
Would you raise your right hands, please? Do you solemnly swear that you will faithfully and impartially discharge and perform all the duties incumbent upon you as a member of the Board of Health of the City of Nashua, according to the best of your abilities and agreeably to the rules and regulations of the city charter and the Constitution and laws of the state of New Hampshire? So help you God.
Very well. Thank you.
I do.
Very good. Thank you for your service.
Thank you.
Thank you. Talk to you soon, Steve. Okay, that being said, let's move on. And approval of the December 2021 minutes, which was last month. There was two typos that I saw, and I guess we got one change, but the other one we didn't for some reason. The attendees, we have Mike Lopez, which should be Tom Lopez. I was just typo there. And the original, she had facilitator me, but it's actually chair facilitator is different. Not equal things by definition. So those are the two typos that I saw. Anything you saw, Stephanie?
No, good eye.
Right, so just house cleaning. I'm looking for a motion to put forward the minutes of December 2021.
Yes.
We have motion, second.
Second.
We have second. Those in favor?
Aye.
Unanimous. Moving on. Thank you very much. Let's go to the director's report. Okay with you, Bobby? We'll go first.
Thank you, Chair, Dr. Sturz. I'd first like to just start off by again reading our vision and our mission, which is to promote, protect, and preserve the health and the well-being of the greater Nashua region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. And we subscribe to the following values: integrity, leadership, adaptability, and respect. Basically, I have a few updates here, which includes a financial update. All of the community health infectious disease grants and the CDC workforce development grant have been approved. These were two big funding items for us that were left on the agenda for the governors and council in December and were passed on December 22nd. And the total amount that the city will receive under community health department is $272,350 for the infectious disease grants, which include our HIV, TB, lead, immunization, and I think that's it. And I said HIV, right?
Yes.
And then the CDC workforce development grant totaling $225,000 for STD workforce was also approved as well. Other financial update is that the CDC Foundation through the Department of Health and Human Services will be funding 2 nursing positions until July 30th, 2022. and we expect for at least one of those positions to start at the end of January. I did include a policy update, and you can see that there are a list of legislation that were on the table. New Futures does give us an update because they do focus on health and other bills that are important for us in public health. And you can see there in your report of bills that were either tabled or defeated or passed based on either New Futures opposing or supporting the bill or the legislation. The bills that were opposed and the bills that were supported are bills that we in public health also support and would oppose as well. The one bill that did not pass, unfortunately, was a legislation that would have allowed for remote access to bill hearings that did not pass, which all of us really believe that that's going to create some problems, especially right now with the increase in COVID and number of individuals that may have to quarantine. It may not give you a quorum to be able to officially have a meeting where you can do voting. And I do sit on a couple of commissions, and we actually had that happen this past week where we met and many of us had to meet via Zoom. And so we didn't have a quorum to be able to vote on anything. So it was just an informational meeting. So I do believe they are going to try and push and put that back on the agenda. And hopefully we'll get some leeway with that. There are a couple of public hearings that were held this week, 2 yesterday and 2 today. One of them is one that's important that would support the opioid abatement funds that would allow for them to add on to that particular bill language that included evidence-based prevention programs, which was not included in the original bill that was sent forward. And the other bill opposes extending the ban to be able to teach on important issues related to diversity, equity, and inclusion in public areas, university, and colleges. And the other bill, the enforcement of the Liquor Commission that would jeopardize the safe operations of licensing and vaping, which is important for the work that we do with BDAS, the Bureau of Drugs and Alcohol and Other Substances. And then the other bill that would repeal the harmful law passed last year that bans teachers from being able to address important issues related to diversity, equity, and inclusion. And what we usually get is information that will come from New Futures on when these bills are up for folks to either call and support or oppose. As far as operational updates, we continue to work to perform our core functions of public health, which is the grant funding that we receive from the state for the programs that I mentioned, immunization, TB, HIV, STD, and lead, as well as the functions that each of the departments delivers for our deliverables to complete our vision and mission for the community. We have had some community transmission of COVID, which has impacted our staff, and this is why, most of the staff, again, so that we can make sure that we distance to protect ourselves. We are also instituting a regular weekly testing for staff if they choose to participate in that. It is not mandatory, but it just will allow for us to learn about our status and be able to either quarantine or isolate if need be. We continue to perform our functions and focus on increasing vaccination efforts at all opportunities in partnership with either the state or our regional partners, and also through the clinics that we provide through our services downstairs. And you'll hear more about that from the department reports. We continue to lead and support our regional partners in vaccination boosters and clinics, and so that will continue on. We can continue in recovery mode as well with the mitigation measures as a part of our emergency response efforts. You'll hear more of that as well from one of our reports. We are completing our community health improvement plan, and we'll be presenting information at our upcoming Public Health Advisory Council meeting, and Jane will give us more details about that. And we've begun our accreditation reapplication process. Our application is due on March 31st. Our team leads have been established, and we will hit the ground running on that. Once we finish with the CHIP, As far as staffing updates, we are welcoming Jonna Martin, and she will be a nurse that will be coming onto the Community Health Department as a part of the CDC Foundation. And Kim will talk a little bit more about her position and the role that she'll play once she's on board. As far as staff development and workforce development plans, this is a part of accreditation. It's a part of what we put in place for our division to continue with our development in our skills. Staff have completed FEMA courses, especially the newer staff that have come on board. This is really important for our incident command structure that we utilize when we're running these big vaccination clinics. And our workforce development plan will be reviewed for accreditation. I continue to participate on a number of boards, committees, and other commissions. And during the month of December, I participated on the New Hampshire Opioid Abatement Commission. I left the other one off, but there's also the New Hampshire Fatality Commission, where we look at deaths caused by overdoses. I participated on the Southern New Hampshire Medical Center Board, as well as the New Hampshire Healthy Children's Foundation for this past December as well. And the highlights include sending out they were weekly mentionables, they moved to bi-weekly mentionables, and this is to just highlight things that are happening here at the division with our staff. We have had the year of December has been another exceptional year of work and efforts by our staff. And so I'd like to thank everybody for their continued commitment, their sacrifices, and just the energy that everybody brings to the workplace. And we also brought in our dogs so that we could have some furry friends here to bring some relief, and they were amazing, and we're going to continue that. Other highlights, our public health effort services staff led successful booster clinics, including a clinic in Hudson, as well as the Milford Booster Clinic, which was a regional effort as a part of the governor's booster blast during the month of December. And we supported, I said the Hudson name already. And then I've been invited to be a speaker on a couple of panels that are coming up. One in particular will be on the 17th as a part of the Martin Luther King celebration at King State University. And UNH has invited me to participate on a panel that focuses on aging in New Hampshire, with a particular interest in African Americans aging in the state of New Hampshire. And that's my report. Do you have any questions?
Bobby, is there anything else just going to go over the COVID?
Yes, that will be under the epidemiologist. Yep. I used to do that when we didn't have the epi, but now that the epi is here, I can just pass that along.
That's good. As long as it's covered. Yes, Chuck.
Oh, no, I love the new future stuff. I thank you for including that now in the minutes. I think that's been great. I'm excited about the dental benefit for the Medicaid program. And I think that's been long overdue for our populations of New Hampshire. And sad to see about I agree about the remote participation in bills, having testified in Concord many times over the years, not to be able to do it remotely. I think that takes away definitely part of our freedom to, open speech. And is the accreditation reapplication every 2 years? 'Cause it seems like you just did that. That's so nice.
Yeah, it's every 5 years.
Every
Yeah,
5
so
years.
we completed,
Yeah, no, every 5 years. Great. And is any other city and anyone else in New Hampshire still? Or are we still the first one?
we're still the first and only accredited health department. I do know that the state health department was in the process of looking at accreditation, and then COVID, right? And so most of the energy and effort has been around our response effort.
Lead the charge. We have a guest?
But there's plenty of guests. There are lots of guests.
Is it public input?
Oh, well, not this part. We don't do public
No.
input till the end, but
Yeah, we
we
just.
just like to know who's in the room.
Oh, my name is Lori Ortolano, 41 Berkeley Street.
Sorry, couldn't recognize you with the
And
map. Sorry.
nobody can. We
No,
ask
no
all the
problem.
time.
No, you have a right to be here, but we'll have a public section.
Okay, yeah, that's fine.
Just like, yeah. Okay. Any other questions? Stephanie? You
No,
good?
no questions. I just must say that Bobby, this is an enormous body of work to have been accomplished during very challenging times with all the extra load of COVID, and to all the staff that are listening, to the staff that are the support, just enormous gratitude. Really appreciate the legislative updates. I think it helps keep us focused on the things that we need to know about, so that we can participate in the decision-making for Nashua based on all, what's happening locally and regionally. So thank you for all of that, and thank you for your leadership.
Thank you. I'd like to echo that. And also like to move on to Kim, I believe.
Yep, so Kim Bernard will do our community health report.
Hi, good afternoon.
Kim?
Hello, can you hear me okay?
Good.
Yes.
Oh, I just lost my, give me one moment. Sorry about that. Okay, so I'm going to be reporting out of the month of December for the Community Health Department. My name is Kim Bernard. I'm the Chief Public Health Nurse and Manager of the Community Health Department under the Division of Public Health and Community Services. So during the month of December, the community health teams continued to provide all services. So all those services that Bobby had mentioned, with all the grant funds that were approved, we continued all of those throughout the pandemic, including pandemic services such as COVID-19 vaccination, guidance, messaging, and education. Just some trends from November to December regarding COVID to mention. Cases have increased from November to December, approximately 48%. Clusters and outbreaks have increased approximately 21%. The majority of these clusters and outbreaks have been reported in schools. We continue with COVID-19 vaccination strategies. Our goal is to try to reach the unvaccinated population. And we have administered a total cumulative of 2,255 total immunizations during the 17 clinics this month. That is including COVID, but not just COVID vaccines. Some of the clinics, Bobby had mentioned some of them, but clinics included a large-scale pediatric and adult booster COVID clinic that was on December 11th at Elm Street Middle School. And we served approximately 1,100 individuals at that clinic. Vaccine management, we have helped out at the Greater Nashua Public Health Network clinics, both in Hudson and in Milford, that were large scale. Second PD and adult COVID clinic at Boys and Girls Club of Greater Nashua in December. And we've also had several booster clinics added to our Mulberry Street location for the public as well as employees of the city. Just to break it down a little bit further, 95% of that total immunizations I mentioned are COVID vaccine. Of that 95%, 54% were from served the 5 to 18 years old populations, and the other 45% was 19 and older, and those are approximate figures. Also want to mention our staffing. Bobby had mentioned Jana Martin, who is being hired through the CDC Foundation. She will be with us starting January 31st until July 31st. And her role will be COVID response. So any COVID response strategies, any COVID response, vaccine clinics, anything that has to do with COVID, she will be assisting with. She does have a background in COVID response as well as behavioral health. So she will be a great addition to our team. We also recently hired Lyanna Perez, who is a registered nurse. She came to us from Elliott, an ED nurse, and she also has worked here for per diem for the last year and a half. She is being hired under a new position that we have grant funds for, and it is a disease intervention specialist and behavioral health public health nurse. So she will be doing some great work in our community surrounding behavioral health and has been working closely. Even though she just started, she's been working closely with our behavioral health specialists, Lisa and Leah. Her the disease intervention specialist piece, that basically is finding and coordinating primary investigations, mostly under STD, HIV, but also in other communicable disease areas as well. So we're really happy to be to have these 2 staff members in addition to our other staff. And that's all I have. If you have any questions, please ask.
Thank you, Kim.
You're welcome.
Appreciate your report. Dr. Chuck, any questions?
Oh, great stuff as always, Kim. Thank you. You worked so hard. Thank you.
Stephanie?
All
any
set.
questions?
Thank you. Good work.
Thank you. Thanks, Kim. Happy New Year.
Thank you.
Next, community services. Lindsay first.
So the epi report,
This one?
no, community services would be the epi report would be the first one.
Right, Lindsay.
Yes.
Yeah, okay. Not always the best remembered name.
Oh, you remember.
Lindsay, would you like to give your report regarding epidemiology?
Yes, so first I'm going to go over a situational update on COVID globally in the US, in New Hampshire, and then it looks like we haven't really discussed Nashua yet, so I'll also cover the Nashua numbers. And then what I'm currently working on and what are some future plans moving forward. So as of right now, worldwide cases, these 312.1 million cases globally and 5.5 million deaths due to COVID. For the United States, it's 61.9 million cases total since the beginning of COVID and 841,000 deaths since the beginning of COVID as well. In a meeting earlier this week with Dr. Chan, he had mentioned that the nationwide increase of 700,000 average cases per day, and about a year ago, it was only 200,000 cases per day for the US. And for New Hampshire, the latest update was yesterday. So it looks like this is an older one, but I can actually read out the update. I have the numbers for January 11th. So New Hampshire announced that there was 1,627 cases with a 46% increase from the previous 7-day period. There was 226,000 total in New Hampshire and 18,000 were active cases. For the past 7 days, there was a 21.2% positivity rate for testing and 12,000 average tests were given daily. There are currently 389 hospitalizations due to COVID and 2,032 deaths in New Hampshire due to COVID-19. And for Nashua, we have 16,037 total cases since the beginning of COVID-19, 1,376 active cases as of right now, and 122 deaths. And then Flavia, I don't know if you want to just pull up, I can read the rest of my presentation.
If you could, Lindsay, that would be great. I don't have the most recent numbers in front of me.
Okay.
Thank you.
Oh. Okay, can you pull those up, the presentation? Okay, thank you. So then this is the graph. So Flavia, the numbers I just read off are the most recent from yesterday. I can also send them through email if you'd like to. It's just this paper was written yesterday, so it's not reflecting the most current numbers. So as of January 8th, it was our highest case count in New Hampshire with 3,267 total cases that day. And when this was written, the projections were saying that it would be the highest in mid-January, but that was actually updated very recently. So it's actually going to be late January where we're seeing the highest amount of infections. And then to look at a little bit of change over time since December 25th or Christmas Day to the 10th, which was this week, there was a 159% increase in daily cases. over that time period, and then 112% increase on a 7-day average. And then for what I've been working on recently, obviously, it's been a little bit less than a month since I started. So a lot of the work I've been doing is meeting with staff members to learn about their individual work, and then also get better ideas of what kind of data I would like to work with in the future. So right now, most of it is monitoring global, national, state, and local COVID-19 trends. And then during the joint partner calls and citywide unified calls, I do report out those numbers as well. I met with Ren recently to review accreditation and what the timeline might look like for that. Let's see what else. I met with Jane to go over the CHIP, and I met with Katrina from DHHS to review how New Hampshire is receiving their data from the lab, and then what might be some shortcomings with the data. So that way I know what I'm working with and what are some gaps that could be worked on. And then I met with several welfare case technicians over the past 2 weeks to learn about their work and some potential data ideas or data projects to work on. I would really like to focus on what kind of barriers individuals are facing when they're trying to meet with welfare case technicians, and what kind of barriers are happening that's preventing them from getting the services that they need. And then I attended the Alderman meeting on the 21st of December to discuss the mask ordinance that's in effect now. And I joined Bobby on Public Health Radio Hour last Friday, and volunteered the booster blitz this past Saturday, where I was the quality assurance person, so checking vaccination forms to make sure that they're accurate and complete. And throughout the time, I've also been communicating and meeting with Angela, the previous epidemiologist and consultant, to familiarize myself with some of the projects that have already been done and what could possibly be in the works in the future. And then, okay, I don't know if you want to scroll down. And for right now, because I am still learning more about the division and what data I have to work with, there's very little strategic initiatives right now. So to continue to meet with staff members at the division and learn about their work. Angela and I are also thinking of a new project called Mental Health Matters, where we'll be focusing on mental health in adults and children during COVID-19. So potentially using ER data and surveying community members, and also continue to learn about CHIP and start getting more involved on that project as well. And that's it. Does anyone have any questions?
Very much, Chuck. Anything on your mind?
Lindsay, thank you. Definitely hit the ground running. Thank you. And excellent report. I'd be happy to, on the mental health matters, if you wanted some, if you need any help related to kids or adolescents, I'm more than happy to help support that if you need me.
That'd be great. Thank you.
This is Stephanie Wolf Rosenblum. Really excited to hear about the staffing and attention and the resources we'll have to increase our behavioral health resources and offerings. One of the things we spoke about in the past before COVID was both multilingual as well as multicultural approaches to mental health. We're aware that in certain populations within our greater Nashua public health area, that some groups may be less open to talking about mental health, and that the approach to mental health may not be the same for every subgroup. So I'm hoping that once you get your feet wet, I know you have a lot to absorb, that you'll keep in the back of your mind, what we'll do to reach these different populations and ensure that we, have diversity and equity in these initiatives. Thank you so much.
Thank you very much. The only comment I had was the joint partner call. I like the way it's set up now. I've been AWOL, so I probably shouldn't make any comments. But I like the way we have the compartments and then each person. And I also told Dr. Thing that I like the Dartmouth matrix that they set up. And I think if we could use that in our reports wherever we can, just really easy for us to see information quickly, digest it, and move on versus reading it. And then what I do is I kind of go side for the cheat notes to that. But if I see a matrix like this or graph, it's just. But anyway, obviously numbers are going off the roof for sure. So, anyway, next up on the hit list, strategies.
Health network strategist, Jane.
Jane, I always forget you. I don't know why I do that. Sorry about that, Jane. Happy New Year.
Thank you. Thank you, Dr. Story, for forgetting me. That's okay. I'm very thick-skinned. I'm very thick-skinned. So I just realizing as I'm listening to everyone's reports that I probably left off quite a few things. It was a very busy week last week getting ready for our booster blitz. So I won't be redundant by repeating what they said. So continue to host Public Health Matters. Still would love to get Dr. Capetta on there. We did have Dr. Beam talk about childhood COVID-19 vaccination. And I, of course, had our director, Bobby Bagley, on as well. I've integrated the CDC Public Health Associate who joined us back in the fall, and she has really just done an amazing job, and we're thrilled for the extra not only help, but also contribution. Mackenzie's been working with me a lot on the CHIP, and she'll soon transition to reaccreditation, and has a very heavy lift right now covering communications while Nicole is out. So the main thrust of this week and next are the community health improvement plan. We're doing our final work cleaning it up. We're using 2 different software platforms. Those of you who are familiar with the community health assessment, we are using Live Stories for that, and we are using that same platform, although we are adding in one more platform called Insight Vision. And that's where we're really going to store all the information about all the goals and objectives and the data that we have, some targets and objectives for that as well. So we continue to master Live Stories in Insight Vision software. Our annual FAC meeting, really should say our annual meeting, which will include the Public Health Advisory Council, will be February 10th. I have sent that out already, and I have 31 people registered. So if you haven't registered already, I will be sending that link out again weekly, so we can get our numbers up and reach as many people as possible. We will have a keynote speaker on that day, and we will also be presenting the CHIP live. I'm mixing up my acronyms. Gilson Road seems to be humming along. Both trailers are ready as usual, and we're still organizing inventory. Continue to welcome Pat as our FEP coordinator, and we are really settling in, and I am going to request a table in my office so he can sit there at least a few hours a day. As far as our COVID-19 response goes, same as what Kim and everyone else has mentioned, we did the Elm Street Clinic. We did a City of Nashville COVID-19 pop-up and for testing. And we did a lot of planning for our Booster Blitz 2.0, but that would technically be in next month's report because that took place last week. But we did have close to 900 people get their booster. It was a great collaboration with the Milford Fire Department and Milford Police, and of course, Milford High School. And then I did speak during the Board of Aldermen meeting around the mask ordinance, so that was exciting. And there are a couple other things, but I think they have already been mentioned in others' reports. So thank you. That's all I have today.
Thank you, Jane. Another busy year ahead, I'm afraid. Yeah, I was going to have something, but I obviously wasn't.
Oh.
Another brain cell. Okay. Our behavioral health strategies, please, Lisa. Thank you, Jane. Stephanie, did you have any questions? I'm sorry.
Nope. Great work. Thank you.
Do we have Lisa on?
My fault.
Okay, do you have Lisa's report?
Yes, I have.
Okay, so for Lisa Vasquez, who is the behavioral health strategist, we are. Oh, okay, so Kim, we're co-opting one of your public health nurses. We are pleased to have Lyanna Perez to the behavioral health team. This is a public health nurse that Kim Bernard just talked about, who's brought on board to work with that team. We're working on finalizing the CHIP behavioral health work plan. And the behavioral health strategist has also scheduled the Arlington Street Community Center for a parenting series for parenting of teens. And this has been an ongoing group with both Lisa and Leah participating in it. This is the first time that we've offered a parenting group in Spanish. And Leah actually speaks Spanish as well. The series is free and it focuses on increasing communication between parents and their teens to strengthen family relationships. The session does take place in person, and we've been fortunate to have the Arlington Street Community Center, which does allow for there to be social distancing. And currently there are 6 participants that are engaged in that parenting group. The behavioral health strategist and specialist also attended the public health hour in December to speak on Presenting Latinos in Vivo, a show that discusses alcohol use in the Latino community. The behavioral health team, along with the Mayor's Opioid Task Force, have been prepping for the legislative breakfast that's scheduled, and the date for that is January 24th. I say the date has gone out, and I hope that our Board of Health members have received that. If not, I'll make sure that you guys get it. And we will continue to coordinate that event. The Board of Health specialist attended the Smart Starts Coalition to report on meetings and to participate as a part of the steering committee members. She attended the statewide meeting to discuss marijuana prevention for youth. Also attended the National Prevention Coalition. The behavioral health specialist attended the Revive, is a member of and attended the Revive board meeting and discussed the upcoming opportunities for staffing changes at Revive. Because the behavioral health specialist work is regional, she also attended the CAS Coalition meeting and attended the Continuum of Care Family Supports meeting to increase awareness of family supports and services available across the state for families and individuals that experience substance use disorders. She's been working with the Smart Start Insight Vision meeting and attended the SMP, which is the Substance Misuse Prevention State meeting with the Bureau of Drugs and Alcohol, as well as the New Hampshire Travel Foundation, and worked to help orient Leah Elliott, who is the behavioral health specialist that's joined the team. And so we did find that it was really important to bring on and strengthen that behavioral health component because of what we've been seeing with behavioral health, mental health, and suicide in our region, as well as in the state as well. And so I'll make sure that I get that, save the date out for the legislative breakfast that's scheduled for January 24th.
Question.
That was a great addition to the team, having her here. Yeah, thank you.
Stephanie?
All set.
Okay, thank you. Okay. Go for it.
So FEP has been very active, as has everyone else, with the COVID response. A lot of my COVID response specific information will echo what Kim mentioned as well as Jane. For example, we held our second Elm Street Middle School clinic on the 11th. We were able to support Hudson Fire and Hudson School District with their second iteration of a clinic. Their clinic was not just for boosters, but it was actually a primary series clinic as well. We are continuing to host a bi-weekly public health emergency management directors meeting. This has been going on to strengthen our relationships, but also create and keep situational awareness with ourselves and the other emergency directors in the greater Nashville public health region. As Jane mentioned, our trailers are stocked and ready for deployment should the need arise. With the increase in COVID cases, our ACS and pods are ready to be set up should the need arise. Again, as Jane mentioned, we organized the Booster Blitz 2.0 event, which is a regional clinic held at Milford High School. It was a great success. So thank you to everyone who participated. And finally, for last month's pandemic response, we are working with our regional partners to develop increased regional COVID clinics with the added age groups now being able to get boosters and the information continuing to change and increase for vaccination. Outside of COVID, for FEP, we are continuing to organize an inventory Gilson Road. We're still getting stock in from DHHS, so we have to continue to inventory all of that. Again, we're continuing to meet and plan to meet with all of our EMTs in person in the region. With the increased numbers, we're holding off on that just for safety. So outside of those bi-weekly meetings, we're trying to meet them in person to really solidify those partnerships. The FEP documents are still being reviewed after moving back here, specifically documents related to reaccreditation, as Bobby mentioned earlier. Again, one of the big reasons for success in our clinics has been that all of our staff is trained in the NIMS model, specifically incident command structure. So we are very well adept to using all of that language, and our compliance is continuing to be strong with that. The only issue is due to COVID. Certain individuals in our incident response team haven't been able to take the higher level courses because they're not offered as frequently because of COVID, but we're still planning on doing those online, and we're supplementing it with a quote unquote back to basics discussion in our internal IRT meetings. And finally, I was able to take part in a web EOC training in Concord this past month. So now we have that added capability to communicate with the state and with our regional partners. And that is all one last thing, main attraction on the horizon is we are planning a clinic at Rivier University for the 24th. We just met yesterday, so there aren't many details yet, but hopefully we'll be able to present that next month.
Thank you very much. Busy? Well,
I like to think so.
okay. Well, our honeymoon's over. Chuck, any questions?
No, great job. Thank you
Stephanie?
very much.
Yes, thank you so much. Great work. We certainly need to focus on COVID, but we've also seen some significant disasters due to weather and other circumstances throughout the country. And we're smack in the middle of, ice, snow season, et cetera. So I just wanted to know if we are also able to, or what's on the horizon for ensuring that people have their own individual emergency preparedness plans. My concern is we know that due to the incredible levels of COVID right now, that there's a lot of staff out in, various parts of the city, in public servants and fire, police and so forth, that, people are in rotating, quarantine and isolation, and just to make sure that people, can be as self-sufficient as possible for a short period of time and not just depend on our public servants.
Absolutely, yeah. So internally, certainly we've had that rolling quarantine and isolation. I myself just returned from isolation. So internally, we are working actively. It's kind of a blessing with the reaccreditation. We're working on our continuity of operations plans, just reviewing them and updating as needed because we have had a lot of staff come on. So internally, we're doing that. Also, I am currently revising a go bag training, so to speak. So again, for that self-sufficiency for up to 72
Great.
hours, especially where we're essential personnel who might have to respond in a public health emergency, should another one arise on top of the one we're currently in. We've been working with our Office of Emergency Management, specifically related to those weather emergencies you mentioned. With our past snowstorms, we've been working very closely with our interim director / coordinator, and that's been going very well. And then part of our training and exercise work group plan, we have to meet because we're due to create our new 3-year program, but part of that is going to be getting out into the community, to go over Go Kits and all of that information. We're actually starting off, we're planning a Boy Scout troop who have asked to come in, see our facilities, and then go over public health emergency preparedness. So myself and our emergency management interim director, we've been setting that up. Again, it's difficult with COVID. We've had to postpone a few times, but we're working on it.
The only other thing I would add is that the Interfaith Council is pretty active in our area. And, for faith-based communities, a way to, spread things out in a telephone tree fashion, if you will, would be to reach out to the Interfaith Council and have the leadership utilize some of the Zoom capabilities they've built up during the pandemic to also be able to present in those regards.
Any other questions? You good stuff? No questions. Moving on. Thank you, Patrick. Heidi and Ren for environmental health.
Yeah, so Heidi and Ren, Heidi will be presenting on Zoom on their report with Ren.
Good afternoon, all. Can you hear me?
Yes.
Heidi Picatoka, Nashua's health officer. I'm remote today, and we're keeping our report fairly short. We are seeing some improvements in our food service establishment, the inspections, because post shutdown, when everybody reopened and got going again, we saw some things that were pretty disconcerting, and it due to a lot of staffing shortages, a lot of new people in facilities, and certainly some businesses went out of business completely. And then it's hard to get supplies, and the prices for their supplies are ridiculous. So it's always in a state of flux, it seems, for food service right now. But so we've been very adaptable and have been trying hard how to figure out how best to support them. And first inspection was more educational than anything else. And we've just gone back to collecting re-inspection fees and the actual failures as of the beginning of this year. And we also are trying to prioritize who we're going to see, making sure that we're not saturating, putting an extra body in there when it's a vulnerable population. And so there's a lot to the thinking. We meet on a regular basis to try and strategize and figure out how to best serve the public and how to best serve the food service establishments. But it is very good to see that the failure rate is going down. And I attribute that to more times in the kitchen and spending a lot of time educating people and trying to figure out what the glitches might be and how can we best serve them. So that's our biggest focus. We also have been responding to complaints, to concerns and to regarding mask use in facilities. We're not responding to complaints specifically, but we are guiding some people on how to do things a little bit better. So all of our inspections, our environmental health specialists go in with a copy of what is supposed to be posted as far as mask use. And we spent a lot of time kind of talking through different scenarios with owners and managers as well. We did our pre-Christmas Eve check of food service facilities to make sure that there weren't say 30 pounds of chicken wings left out at room temperature because it's great demand for takeout that night. And we had one emergency, and I'm just trying to, I have the sheet in front of me. Plenty of meetings. We're also watching legislation as well. Quiet for rabies, which is good. We're thrilled about that. I saw that Merrimack just recently had I think it was a positive bat. So we're always mindful of that. Ren, anything else that we should add?
Heidi, thank you. No, just pretty much what you're saying. Again, there's a huge impact out in food business. A lot of staff right now. I think a lot of just everybody with the virus, the new variants ripping through everywhere. So it is creating a lot of staffing issues. So a lot of places have either closed on a temporary basis or have to kind of modify their format of how they're going to serve people. As Heidi said, we're also following the LSRs, the House bills that are out there. We're just getting language now for a couple of them that pertains to food trucks. So that language just dropped last week. So we're going to see how that could potentially impact us. Meeting with our state partners for the self-inspecting meeting next week, as well as the arboviral illness task force, which will be meeting soon to look at what this upcoming arboviral season will look like, and the testing measures that they're going to be looking for, as well as an increase for Jamestown Canyon virus, as we did get a lot of hits, at least on the coastal areas or so this year. So we'll be looking at the impacts of this past current year, as well as what may be in store for this upcoming year. So those are things that are on the horizon. A couple other projects with our state and federal partners that we're working on that we mentioned last month. We do not have a full update yet, but we plan to work through those as they come through, and should have an update on those at our next meeting.
Thank you. Anything, there it is, I ran. Any questions for Heidi or Ren?
Yes, for both of you, thank you so much for your hard work. Could you give us an idea in general terms what an emergency is and what the response time that we have set for ourselves?
Yeah, we can certainly do that. So one of the things that we see, so an emergency could take on a bunch of various forms. So we, the one that Heidi is speaking about is in food service. So let's say a fire happens on a cook line. Fire dispatch will call our office. We have to go out there to see what the impact on the food was and what they have to toss out. So generally our response time when they call, we're generally out there within 15 minutes to a half hour to be there on site. That could happen at 2 a.m. if a sprinkler goes off. That can happen at 3 in the afternoon. So we are on call 24/7, and we're generally out there within a half hour when that happens. Other terms could be housing. We have been called out. Issues I think Pat had noted with the Office of Emergency Management. We may get called out sometimes to certain housing. Once again, based on what that is, the response time could be again within a half hour, or could wait until the next morning. So that's on a case-by-case basis based on what's actually happening.
Thank you. That's very helpful.
All set, Stephanie?
Yes.
Thank you. Chuck, do you have your hand up?
Yes, Ren or Heidi, has there been any pushback from business owners or restaurateurs with the mask stuff? Just curious on your thoughts versus last year. Is people more aware of it, obviously, and more able to maintain it? And what's your gestalt and your sense of what's happening out there?
Well, I think that Ren and I have both had some agitated people call in, but I think that we tend to be able to work, if it's a phone call or we're in person, we tend to be able to find some common ground, explain our stance, why things are important. And then typically those conversations are pretty respectful. But we try very hard in Nashua to maintain relationships with our business partners. That's critical for us. So we typically come at this from a point of mutual respect. Ren, is there anything you'd want to add to that?
Yeah, it says pretty much spot on. You know, there are those very rare cases. I had one last week where a person just did not want to follow it at all. At that point, I had to call the actual corporate office, speak to those folks, let them know what was going on. So they had to call their local restaurant and let them know. So it ended up working out very well. I just happened to go a little bit higher in that food chain and just had to have that serious talk with them. You know, just like Heidi said, you got to sit down, you really got to educate them, you really got to speak with them. And once you're able to kind of hear their like frustrations and then share what you have, you generally tend to build that trust up with them and not just be some faceless person just handing down some like mandates. So it's really helpful to have those talks, and it's been really helpful. I know that the community health workers went out last month and they handed out lots of signs and masks, and our staff are doing the same thing. We don't want to leave people hanging. So when we're out there, we're not only handing out signs, we're handing out masks because we know people may not have them. So we want to make sure that they have every tool that they have to work through this mask mandate, you know, while it lasts. And they've been very thankful for that overall.
Oh, thank you. Thanks for your hard work there. I know that's hard to do sometimes. Thank you.
Heidi, I have a question.
Sure.
In light of the hardships that the entrepreneurs are having out there, and we gave them a break last year, and your comment about their costs being ridiculous this year, do we want to look at doing the same this year as far as the cost to inspect or re-inspect or whatever? Because in your report, it says starting this year, we're going to charge. So what's your feeling on that? And is it, or am I
That,
just-
yeah, it's a tough call. We've met several times. We actually meet regularly about this, and it's on the table. And we opted to go back to the reinspection fee because we had some people who it seemed almost that they were not terribly motivated to make changes. And it's a tough call. But
can we use a little carrot and stick in the fact, I mean, you're in the trenches, so I'm not telling you what to do, but maybe just offer a suggestion. And that would be, there's no fee, but if they don't follow the rules, then we're gonna start to charge.
Well-
on an individual basis, or do we have to have a universal rule that applies to everybody all the time?
yeah, it's got to be a standard. It's not something that we could pick and choose. So
Could we look at it, they're really in a tough position now compared to last year, between the staffing, and that makes, I remember back in the good old days, we used to say, or we used to hear from you, that one of the problems is the staff turnovers all the time, and as you try to educate them, the next thing you know, we got new staff, et cetera. Right now, they love to even have new staff because they can't get people to work. And so that puts them on a financial crunch, mandate crunch as far as, the thing, the P's and Q's that they have to follow. I'm just looking, can we be benevolent? And I'm certainly not lobbying for any one person or one place, but I'm just looking, is that something we could do maybe on a short-term basis, 1 or 2 months until we're out of this?
well, yeah,
I'll let you guys decide.
yeah. Ren, how long did we go without, was it 2 years with no reinspection fees?
Since we've resumed routine inspections, so going well over a year at this point, we've tried that, let's kind of hold them off. We've extended that multiple times. At first, we were going to do for a couple quarters, and then it turned into a year, and now it's turned into a year plus. And as Heidi said, trying to allude to the fact that there are some people out there that if there's no teeth to anything, they're going to use it, and they're going to walk all over you with it. And in the enforcement world, you have to treat everybody on equal footing. So if you do it for one, you have to do it for all. So we've come to that point where word gets out, and if you don't have those teeth, they're not going to change. And again,
Right.
it's not everybody. This is a few people, but unfortunately, those few people could ruin it for everybody. However, with that being said, as the report states, our failure rates have gone down tremendously over the last quarter. We were in almost 1 in 7 places failing, which is exceptionally high now, to again like a 2.6% rate. So that's much lower. So people are getting it. They do realize that, and I think it's because they've been warned that this is coming. So again, we've lobbied for this a lot. I've lobbied that we go back to to those fees for this purpose, and that message seems to be getting out there, and that's why I think we are seeing places do better. So I'm for sticking with it, but like Heidi said, we meet on a regular basis to see what the trends are, what's going on, and if we see too much of a financial burden, we can absolutely scale back, but we got to do it on a consistent basis.
You're looking at it, and that's fine. That's a good answer.
Another thing too is that we haven't ticketed anyone for a very long time. And that's in our toolbox as well, because a lot of the tickets could be for things, for violations that are not what we would consider critical. And so we're trying very hard to make sure that we're doing the best job that we can when we're actually interacting with somebody, teaching them to the best of our ability, but we're not trying to be punitive and trying to keep our revenues up there, because that's not what we're about. We're all about food safety and protecting the public. So it's a tough call. We will continue to discuss. We'll continue to keep you updated as well.
Thank you. And I'm sad. I mean, you said it all. Appreciate
Thank you.
it. Yep. Thanks for all the hard work you do and keeping us safe too.
You're very welcome.
Any other questions? Seeing none, somebody needs to wake up Bob. Mr. Mack.
Good afternoon.
Hi, Bob. I wasn't sure you're still with us.
Thank you, Mr. Chair. Yeah, I'm wide awake. So thank you very much. Good afternoon. Bob Mack, the welfare officer for the city of Nashua, just reporting out on the welfare department for the month of December. You can see the report here. Basically, the welfare department continues to administer the general assistance program in accordance with RSA 165, the state statute, and our general assistance guidelines for the city of Nashua. You can see our expenditures are fairly level compared to last year at this time. You see a slight increase in some utility assistance and actually some burial cremation assistance. We're one of the only programs that can offer burial or cremation assistance. Typically, we don't see a lot of that, but we have seen a little bit of an increase in requests for that. I think it's because, you know, with the economy, people are feeling the pinch of costs rising, and they don't have money set aside for these sort of unexpected expenses in some cases. We also primarily deal with a lot of indigent individuals who have no next of kin that may either go through the hospitals or the local funeral homes. And so they will contact us and we will help to just kind of alleviate some of their expenses. You can see again with the chart, our expenditures are fairly level compared to last year. Okay, if you could move on to the next page. Thank you. Our numbers again are fairly level as far as contacts. The number of new applicants has gone down, and the percentage we assist has gone down slightly. This is primarily in regards to the due diligence of our staff that are really assessing cases and referring people to other alternative resources in the community. We try to leverage those resources as programs have developed in emergency response due to COVID primarily. We refer a lot of folks over to Southern New Hampshire Services for that emergency assistance program. I think as of the time of this report, the state had spent some $70 million in assistance for rent, utilities, and some other COVID-related assistance for households that were feeling hardships. That includes about $29 million that was administered in Hillsborough County. which of course Nashua is part of Hillsborough County. We assisted some homeless households with temporary motel placements through the month of December, and we're able to connect some of those households to emergency shelter programs. We continue to work with the Greater Nashua Continuum of Care and the Crisis Assessment and Referral Program to divert any homeless households that we can directly to emergency shelter or alternative, more permanent housing options as they're available. The rental market continues to be very tight in our community and around the state. We've also been engaging and continue to engage with our outreach teams in the community. And we are planning to participate in the upcoming point in time count, which will take place January 26th of this month here. And that's a concerted effort to go out and get a good count of the homeless in our community and in our region. To date, we've expended about $154,000 of our general assistance budget through December. That's about 32% of our general assistance budget for the year. This compares to about last year at this time, we had expended about $189,000. So a slight decrease in what we've issued for expenditures. Again, I would attribute most of that to the fact that we're connecting people to these alternative resources in the community. One other thing that was mentioned, it's not in our report, but it was mentioned, the environmental health response to some of these emergency situations. Occasionally those involve residential units, and what we've been trying to do and have had some communications on with environmental health, Office of Emergency Management. We're bringing in our public health emergency planning coordinator with environmental health, the Nashua Fire and Rescue, and the Red Cross. After that initial response, Red Cross is very good at responding in the first 24 to 48 hours to assist people. Sometimes that assistance needs to extend beyond that time frame, and that's often when city welfare will come into play, and people will be referred to us for some supplemental assistance. And if it gets to be a longer term process, we try to connect them to more long-term mainstream resources in the community in addition to any assistance we need to offer. So we had some of those conversations, and we'll continue those conversations moving forward. That said, that concludes my report. I don't know if there are any questions.
Thank you, Bob. Sure.
All set.
You
Thank
good?
Bill.
Thank you, Stephanie.
Not at this time. Thank you.
Thank you. Appreciate it. Bob, Happy New Year to you and your family, from me and our family.
Thank you.
I have a question. I finally realized I wrote the question that I forgot down. So how are the numbers? Because we were in the joint partner thing, we were always looking at Massachusetts because we were worried about some spread coming this way. How are the numbers in Mass?
We haven't been following the numbers in Mass because ours have been so bad.
Yeah.
That's.
I understand.
So the real focus has really been on what we've been seeing in New Hampshire. Last week around this time, we had a 55% increase in the state in the number of cases.
Yeah.
Today is a 40% increase over from the last 7-day period. What's been expressed as across the country, the numbers are bad everywhere. When I say bad, the rate of increase is extremely high and extremely fast. It's been contributed to the Omicron variant, which is highly transmissible. There's been a lot of talk about it being not as fatal for some. And because you have to put it in perspective. So for those that are unvaccinated across the country, most of the hospitals are seeing a high percent of those individuals in their hospitals, in the ICUs. Individuals that are vaccinated, if they are in the hospital, they're able to be treated and released sooner. But it's those that are unvaccinated that are really driving what's been the crisis situations in the hospital across the country. For a while, New Hampshire was leading the country as far as cases per capita, with the extreme rise in cases, and now the rest of the country has caught up with us. But we're still setting records ourselves in our number of cases that have been reported. We do have a lot of testing capabilities and opportunities for folks. And I say that, you know, with the caveat of our testing sites have been overwhelmed. So much to the fact that some people have been turned away because they run out of supplies. There's testing kits that folks can get online. So if they go to the state's website, they can get the PCR or a rapid test. They're making the options available in lots of places, and we're still selling out. With that said, with the numbers that Lindsay reported, this is still an underreport of what it looks like in our state with regards to what we're seeing with, you know, the virus and the infection and what's happening, not just here, but across the country. So we haven't looked at Massachusetts, Tony, only because we just have been just looking at ourselves for what's happening. The state just put out their 54th con, which is a health alert. Do you guys get that? Because I was going to send this forward, but I wasn't sure if you guys got it already.
Yes.
All right, so I'll make sure that you all receive that. So I will send this out to you all, but it just speaks about the rapid increase of cases.
Sure.
And what we need to do going forward with Omicron. They're going to bring in, of course, the therapeutics or the medications. There's another medication that they believe will work with Omicron. Still pushing masking, still pushing vaccinations and boosting, which we believe is really for people that have been coming back positive. Their disease has not been as bad, although people have been sick. It just has not been a sickness that takes them to the hospital where they stay for a long period of time if they're vaccinated.
Severity is definitely.
The severity is different, but with the increase in cases, right? With the increase in cases, you're going to see an increase in the number of hospitalizations, and you know, it trends. So right now, you know, we're where we are. 2 weeks, 3 weeks from now, that number of hospitalizations may go up because the amount of infection that's in the community.
Well, one of the reasons I was asking is a selfish reason, because we're having our big meeting in Boston last weekend this month. And they're still charging full steam ahead that it's gonna happen. And these things, I sit on the committees, and I'm basically saying, what's gonna determine this is not really whether you say go or not go, it's gonna be whether people want to fly to Boston.
Right.
Or drive down to Boston. It's a regional, it's actually a national meeting, but it's really primary focus is in New England. And that's what's going to determine it. You know, they cancel the hotel appointments, this, that, and the other thing. And I keep saying that this has been under wraps. You know, you have like a panic fund, you know, you get insurance, interruption insurance, or something like that. And no one's saying anything, so I don't know if they have it or they just don't feel the pressure from doing it. But I said, we're seeing the numbers not falling off the face of the earth, that everything's going to be normal come the 28th of the month.
I don't think so.
I don't think so either.
I don't
I didn't know if
anticipate,
there was some magic, you know, maybe they wrapped Massachusetts in aluminum foil. And
No. And in fact, Lindsay talked about the projection that we thought was going to do the spike in mid-January is going to be later in the month.
That's why.
So a lot of activities that might occur if they're staffing, right? And so right now you're getting the staff that are being impacted by the virus. So as you know, there's been the change in the isolation quarantine time that's been pushed out by the CDC, and New Hampshire has adopted that.
Right.
Not sure how Massachusetts has adopted it, but in New Hampshire, the way that it has been adopted is it's household contacts. The CDC's is broader, it's any contact that you've been exposed to in quarantine. And New Hampshire is specifically household contacts because we've identified it as that is your most riskiest contact because you're in a household with individuals closer for longer periods of time. And so the focus has been on that. But with that 5-day quarantine or 5-day isolation, the other 5 days, if there's no other symptoms, and then there's some other bullets under there, as long as these other criteria is met, no symptoms and resolving, then folks can go back to work with a well-fitted mask. And they've actually even changed the criteria of that. So we've got like 3 variations in here. We've got a cloth mask, which is much, much better than a gaiter. And then we've got the surgical mask, which is better than the cloth mask. So you can see I'm double masked with my surgical and my cloth on top. And the most well fitted is going to be the KN95s. And that's what they're pushing out, especially with this change of going back after 5 days, because people could still be
Exactly.
carrying virus. You know, they pick that as a number, but I mean, it's 2 to 8 days that you could be spreading virus or infectious, and even longer for some.
Yeah, and
But
also, the
they're-
thing
they're
a lot
trying
of- a lot of
different
people don't realize is when you're testing, Delta tests different than rapid tests. Than Omicron. So
Correct.
what happens is, one is almost immediate, the other is 4 days down the road. So if you take the test for somebody's in your household and you come up negative, that doesn't necessarily mean you're negative.
Correct.
And also, like, from a trusted source, somebody said, because one of the things that we were looking at from the Dartmouth numbers on the second, they had a 46% testing. And my source was saying to me, is that accurate? And it's actually, it isn't accurate because we have the test at home kits, which you can call in and say, hey, I'm positive, but probably most people won't. And we also have a group of people that have subclinical symptoms or no symptoms who are active, and they don't even get registered. So this number is definitely high. How much higher? Yeah, it's an academic guess, but it can be higher. The other question, another source came to me, and not source, but somebody asked about the mask, and about the cloth masks, and I explained to them, because we got this discussion.
Yeah,
before, the
I mean, they
cloth masks,
work.
They kind of work, but they should have, you should have the ones that have partitions that you can put filters. And you have to wash it, you can't use them forever, you can't touch them if they get wet. You know, there's certain guidelines with the
Right.
masks. The N95s were, you couldn't get them even if you wanted them. Now I think you can get your hands on them, or you know somebody can get their hands on them. So, but likewise, I was at a restaurant and back at the bar, was panic all this now.
Tony, I'm having trouble hearing you. In
You're just
the
talking about
last
you.
few comments that you said.
I'm not sure which comments, so, basically, we're talking about the masks.
No, yeah, it's just that when you turned, the last few things that you said.
No, we were talking about, positivity, well, I was talking about it.
Yeah.
Actually. Positivity and the numbers that we're getting, I used Dartmouth, the recent ones from the joint partner call, they were 40% positive, and we were saying that's probably not the true numbers out there if you want to extrapolate that to the community, because we have people who have home test kits who are positive and don't call into the government and say, hey, I'm positive, so those numbers are
Correct.
counted. And also people that don't have symptoms or are subacute symptoms that they think it's just a regular cold or a runny nose, or it's my sinuses, and they never get reported, but they are active as well. So the numbers are quite high. There's no question.
Yeah.
about that.
So Tony, a couple of quick things, because I'm mindful of the fact that Dr. Capetta has to get back to his clinic.
Right.
One is knowing that not everybody has access to masks that have filters or N95s. I want to make sure that we emphasize that, you know, a 3-ply mask is, definitely cuts down transmission. It may not be as effective as the others, but there are gradations of effectiveness. Also, one can improve the effectiveness by taking a surgical mask, a simple paper mask, and putting a cloth mask over it, because it helps the fit. And does not typically interfere with airflow in any substantial way. The second thing is Massachusetts is having as many, if not more of an issue with the transmission of the Omicron. Their deaths are up 22% this week. And in late December, the governor took the unusual step of requiring hospitals to cancel elective surgeries. Of the 5,000 hospitals in the United States reporting on this, 24% are reporting critical staffing shortages. So for all those reasons, this is not isolated. Our concerns are not isolated to New Hampshire, but also our surrounding states. And that actually brings me to a request that we convene next week for the ancillary meeting that we had designated each month if we had things to discuss. We've heard several times during this meeting that the peak we expected in mid-January is expected more in late January. We also know that people that are hospitalized for COVID end up with very long hospitalizations, several weeks, ICU stays that are extended a week or 10 days, which is more than the usual 2 to 3 days, that the ICUs for an ICU stay for a non-COVID illness or an illness in someone who does not also have COVID. And we know that the mask mandate or the mask requirements that we had recommended to the Board of Aldermen is set to expire at the end of the month. And I think it would be our obligation to meet next week and review the data and see if the projections are correct, and also to see if we would recommend an extension or provide some opinion to the Board of Aldermen saying that we think that, you know, it is a suitable time for the mask mandate to lapse. I think that that's our obligation to do one or the other.
What is the will of the board? Chuck, do you want to meet next week?
No, I agree. I think that's appropriate.
All right, so we'll meet next week. Anything else, Stephanie?
Nope. Thank you.
Okay. We'll use the position of the chair to say one thing. I happen to trip on Dr. Levy, who was our pediatrician for many, many years, and was chairman of the board for many, many years. And as my next neighbor over, and we used to see each other walking, and we don't see each other anymore, which is probably because I don't walk as much as I used to. But anyway, he's doing well. He's staying active, and he's wanted me to express his best wishes for the board. He understands that we're doing some difficult things right now. If there was anybody here that still remembered him. So,
Yes,
but anyway,
absolutely.
I love you doing fine and enjoying life. That being said, I'd like to close the official part of the meeting and open up the public comments.
So we'll have to watch the hands,
Yep.
folk here.
You guys do that.
Are there, do you see any hands for public comment?
I don't see any hands.
Hi. Lori Ortolano, 41 Berkeley Street. I'd like to ask the board to try and get more data that's specific to Nashua. I just heard Stephanie Rosenbaum talk about, we know when people are in the hospital and they're in ICU, it's more serious and they spend more time, but that really depends on the patient in there.
It does.
It's not that they all spend more time. I've been following the Nashua hospitalization data, and I know one of our hospitals has maybe 24, 25 patients. At one point, they had 40 come in a couple weeks ago. Turns out a dozen of those were incidental. They didn't come in for COVID. They came in for another procedure and they tested positive, not knowing. Massachusetts is starting to report incidental data now. And I think that's a great thing. And New Hampshire should look at that.
Mm-hmm.
But when I look at 25 cases in a hospital that has 190 beds, I don't see it overwhelmed with COVID. I see it as a factor, but I think part of our hospitalization issues are a management problem. A long-term, a big top-level management problem. Not any of the workers. It's the strategy of how we've handled hospitals. And that is nobody's specific fault except those top-level managers that have to bite into what's going on here with how people are paid, how they're staffed, and the number of hospitals we've opened in the state in the last 40 years. I am not a supporter of masks anymore, but I was. I put a mask on 3 weeks before there was a mask order. I wore it. I don't wear it anymore at all. I picked the least effective because I have the easiest time breathing. I don't like those masks at all, and I've worn them for months. But they're so restrictive, and like when I'm giving public comment, it's hard for me to comment. When I know I'm under a time pressure, I want the easiest mask. I wish I could take it off. I don't shop in Nashua at all, but I go to other surrounding towns, and I don't wear a mask when I go into the market. I will tell you, I don't go out a lot. I haven't been in a restaurant in 6 weeks to even pick up a piece of food. I haven't eaten in a restaurant in a long, long time. I had an alderman invite me to coffee in a restaurant to come out like this week. And I said, no, I wouldn't go in a restaurant right now, but I invited them to my house for coffee. I'm willing to do that. So I think that we're treating Nashua like it's an island. And I look at all the towns around us that aren't masking. Concord voted no a couple nights ago, 11-4. Manchester doesn't have a mask mandate other than you wear it in a public building. And we've had that right along too. So they've had it with us. When I look at the numbers, I don't know that I see the masking is effective. And I think you have to try and look at that. When I came here to the mask meeting and the discussion, there was a lot of concern about the overload on the hospitals. And I get it. But again, I don't think it's necessarily the COVID that's causing all of that overload. There's some management issues there. But I think, I think we got to be careful of the fact that we're not an island. We have all these other communities that feed those hospitals. And if Nashua is going to put their masks on and abide, but Hudson, Amherst, Salem, all these other towns don't. All of these outreach towns, Hollis, all of them don't. They feed our hospitals. And I don't know why our hospitals can't give us data on Nashua patients versus all surrounding areas for COVID. That to me would be easy to get. And also, they occasionally report vaccinated and unvaccinated, but they don't do it with any consistency. And my feeling is sometimes when the cases are higher for vaccinated, they don't report it because they don't want people to think, oh, we have 18 vaccinated people that came in and 12 unvaccinated. It does flip-flop, but they don't report it. And as far as, what the right answer is, I have a sister who's autoimmune. I know you gotta go. Okay, bye-bye. Who's autoimmune compromised. She lives out in the West. She got the 2 vaccines, the booster. Christmas time, the 21st, her family, her grown daughters and babies came in. Everyone was vaccinated except the 4 children that were under 5. They caught COVID. Okay, so all 9 of them. Okay, so it's all wiped out. My sister was autoimmune compromised, had the most mild case. She had a head cold. But her doctor was like, I'm scheduling you for monoclonal antibodies because you are autoimmune compromised. So she went in within 4 days. Did that for a week. Last Tuesday, she got double pneumonia. 2 days ago, she had a massive heart attack and had a severe blood clot in her heart. Half her heart was clotted. And the doctor who put the stent in said, I spend every day removing COVID clots from patients. She did everything she could. And what happened to her doesn't make me want to put a mask on or say masking is going to make the difference here. Because people who have lived their lives under heavy prescriptions, for 30 years, she's been under heavy, heavy drugs with a lot of complications. You can't stop that train. I don't think you can. And I don't think telling the children to wear the masks is the right thing. The schools, frankly, if you look at the city, they're all over the map on this. Sports. Private schools, kids play sports without a mask. Public schools, they got to put a mask on. They're all over the map. So I would really love you to, when you meet next week, I would really love to see more specific Nashua data because I am not sold that this is effective and I don't wear them anymore.
I'm going to cut you a little bit because it's a three minute.
I'm done.
Okay. We do have stats. I'll just tell you that.
Okay, but they're not presented.
They're not presented because they don't come from this committee. The hospitals do present stats.
Oh, I know, I have those. I do have hospital stats, but they're not consistent. My issue is the hospital stats that I'm getting from their daily reports are not
My
consistent.
suggestion would be to talk to the hospital if you feel they're not consistent. They're outside our purview. We have no jurisdiction with them or anything.
Well, I don't either, but you would have more jurisdiction than me, certainly.
Well, the joint partners present their statistics every week. They meet at 8 o'clock in the morning.
Who are the joint partners?
But, so we meet on a regular basis, and I'm so sorry to hear about your sister. And we'll talk a little bit more about like all of that, but the joint partners meet, we've been meeting since COVID started to get situational updates from all of our partners, which includes our hospitals, the mental health centers, our community health centers, home health and hospice, our long-term care facilities in the area also would attend these calls. And it was to give us, you know, what is the situation that's happening so that if we needed to set up an alternative care center, we could, or what are some of the other strategies that we could put in place to help prevent what we're seeing right now in the hospitals or to support one another. And so as a result of these joint calls, our hospitals have worked more closely together. So even where they're only a mile apart, historically, I've been working in this community about 20 some odd years. So historically, yeah, there's a little bit of competition between all of the organizations because of funding. But as a result of us coming together to work more collaboratively, that's what folks have been doing. And these joint calls allow for all of our healthcare, mental health, and community health centers to talk about their situation so that everyone knows what needs to happen, because everything's connected. So the long-term care facilities might get patients that come from the hospitals or have to send patients to the hospital. Community health centers are seeing certain things that then could preempt what could be going into the hospitals, as well as what we present out at public health. Each week they report out on, they do give us the general number of cases that are diagnosed with COVID in the hospital. They don't give us, like, for instance, after folks get there and they get reported, we don't get that, because someone did ask about that information for more clarity.
Okay.
As far as once they're in the hospital, does their status change because then they were tested and they became positive, or they were in there so long, they're testing negative, are they still included in the count? That's information that Dr. Sturz is saying that can be clarified from the hospital that does monitor that a little bit different. Each hospital has an infection control person that leads over there, and that information can come from them. We will have the opportunity to have, I've invited hospital folks to come on Public Health Matters this Friday to talk about the situations in the hospital.
That's good.
We could also, Dr. Sturz, as when Dr. Wolf Rosenblum asked about doing another meeting, I wrote down here to invite someone from the hospital, because that information does need to be shared. And some of the presidents or CEOs of CMC and the Elliott, when they've talked about like what's happening, it's a combination of things. So it's not all just COVID, but when you get, if you get, one of the hospitals had 38 individuals that were positive with COVID between the 14 in ICU, 14 out of 16 beds filled in ICU, and more than half of those folks being COVID. That requires a lot more acuity and a lot more attention to that person, and they stay a little bit longer. When the hospitals are talking about the impact, it's because it's COVID and COVID related, because the other individuals that are there for other care are compromised. Because if I have to have, ICU nurses can only have 1 to 2 patients, and depending on the acuity of that patient, they may only have one. So you've got a 1-to-1 situation in your ICU. The emergency rooms, as we learn each week, you've got everything going in there. You've got COVID with COVID, you've got people going in to get tested for COVID that shouldn't be there. So we're trying to get people, don't go to the emergency room for a COVID test. That's not where you need to be.
Yeah.
But they're there, they're in the queue, you got all these folks, and then guess what they're also doing, exposing other people while they're there as well, if they end up with COVID. You've got your motor vehicle, you've got your stroke, you've got your cardiac, they're seeing all kinds of things. So when they report out, they let us know what percentage is COVID that they're dealing with, and then they've got these others as well. Even in the ICU and on the bed, one of the hospitals reported out they had 4 people on the bed, only one of those was a COVID person. The other 3 were people that didn't have COVID, but are on the bed, in that ICU, that those individuals may not necessarily get all the high, they're gonna get the high level of acuity, but that other person's gonna get more attention. You're right, it is a combination of administration and hospital services, and that stuff was going on before COVID hit.
It was.
Right, and so when you have those types of things going on, and then you have an event like COVID, and then you have overdoses, because our overdoses numbers have increased as well. And then you have hypothermia patients going in because of this cold. you get the storm. There's a word that goes before the storm that I don't use, but you get the storm, right? That's happening. And that's where they are right now. And it's been overwhelming for all of our hospitals. So not just Southern and St. Joe's, but seeing all across the state. And then they're finding it all across the country because of the situation that was going on before, which is all of this, they gotta merge and gotta do this just to survive. All of that stuff was happening before COVID. And now you get this. People are doing the best that they can with the resources that they have. You know, the National Guard is coming in, FEMA is coming in. You've got other volunteers going in to help with non-clinical things. And then when you look at, again, you've got people coming in, what are they also bringing in as well? So they're doing lots of testing with all those things.
I just would like you to bear in mind too, last night, the mayor's report to the Board of Aldermen was that he expected the peak in mid-February.
That's for the hospitals.
Okay,
So remember, the hospitals are gonna lag. So the
Right.
peak that Lindsay talked about and now that they're talking about nationally is that because of what we're seeing with Omicron, and a lot of people are getting sick with Omicron, some milder than others, but we expected, and this is why we put the mask mandate in place for the month, hoping that if we covered up, that would really reduce. So even though you don't like wearing the cloth mask, it really does stop some of the droplets when there's opposed to no mask. So we were thinking by mid-January, right, you're gonna have the peak after Christmas, after New Year's is when you're gonna see that peak. Now that they're seeing doubling and doubling and doubling week after week, it's been pushed back now to the end of January, but that's just for infections. The peak for the hospitalization, we were looking at around February 11th or 12th. That might also shift as well. The more cases that are out there, the more opportunity for, unfortunately, like your sister, those that have a compromised immune system.
Yeah.
Even with vaccination, even with booster, remember that immune system is going to respond to what's being put in to help it. And the more immunocompromised a person is, the less their immune system is going to respond to the antibodies like that. And so the HAN that went out is to recommend these treatments. So giving people these treatments earlier on so that they don't end up in the hospital.
Yep.
So I'm so sorry about your sister. That's a case that a lot of immunocompromised, individuals.
It's the story of that group.
Yeah, and so our goal with the public health things is, if we cover up, reduce the amount of droplets that are out there. If we distance like this, so right now with the social distance, and even if you're wearing that mask, you're safer, right? Because we've got distance.
I personally think I'd be just as safe with the mask off in the distance here.
And
that's honestly how I
and
feel.
that's actually
Well,
true. That's
let me ask
actually
you this
true
question.
because of the distance, right?
Right.
Let me ask you this question. You don't feel that the mask works, okay?
I don't feel that the mask is used consistently in a way that makes it effective in the city. If
Well,
everyone wore the mask
well, we
and you
don't
didn't
have
have the restaurants open and the bars and the casinos, it might be different. But when you
Well, you don't
allow
have-
people
You don't
to-
have control over that.
You
It's
do
not-
have control. You shut down businesses before.
We're not gonna do that again.
Right.
We're not gonna
And so if you're
So
not
you don't
doing,
have control.
We didn't shut businesses down.
That's right.
right,
Yeah.
well, I'm saying we were.
Right,
But-
and that
but
came,
do
but that
that.
came from the governor, and I don't think he's gonna do that.
Right, so,
Mask works, mask work, okay?
So-
anyways,
This is
doctor.
Stephanie. If I may say a few things just quickly. Thank you so much. Lori, we really appreciate, you coming to so many meetings and being so civically involved. What I hear is a request is to make sure that we make our recommendations, that our discussion next week include the best available data and to see that we,
We'll try.
I'm sorry?
or Nashua.
Yes, I understand the best available data. And it just, relative to what our discussion will be next week, because it will be a limited meeting just to discuss about recommendations about masks. And that is done in the context of the cards were dealt. you know, I understand your concerns about administration and so forth in the hospitals, but we will be discussing data in the context of the cards we're dealt at this moment. And then if you heard Jane Goodman earlier in the meeting talking about the Public Health Advisory Committee, there are, and all the amazing preventative work that's going on in the community, there'll be opportunities in that context, long-term down the road, to try to impact and partner with health entities throughout throughout Nashua. But I just want to make sure that that the expectations for next week's discussion really center on that very limited set of parameters, if you will. Is that?
Yeah.
Okay,
I
thank you
appreciate
so
it.
much.
Good.
Are there any other hands?
I don't see
We
any.
don't see, we don't see.
Yeah, I
hands.
can tell what hand would look like.
But Ms. Odorano, thank you again, because, I mean, these types of conversations are what's important, because it allows for community to hear where, as public health, we sit with looking at how can we protect the most vulnerable in our communities?
No,
And
you know what? You speak and allow me to speak and answer the question and show me courtesy that I don't get many other meetings in this city. So you've given me more than I deserve, and I'm really happy I came.
No, you deserve. to be
And
heard.
I'm really happy I came, and I do appreciate your work. I happen to be on a little different side of the view, but you know what? I have my right to go to a different town and go shop and do what I do. So
Yeah.
I'm not hindered by that. I have my rights. So I don't feel you've taken that away or anything. I just question how the data is compiled and how
Yeah.
it's presented more specifically to
Maybe,
Nashua.
maybe we could do a better job of that.
Yeah,
Maybe we
just
can get a
understanding.
Better job of compiling that.
Yeah.
And have that available for you.
Yeah.
We don't have any control over it, obviously. but
Right.
we do.
No,
I'm
that's
saying-
okay.
Okay, so we can work on that and you can review it. And
Yeah, no,
maybe it
I'm-
makes more sense. Hopefully it doesn't make it cloudier.
you know,
That's not our
it's
idea.
it's an
Yeah.
adventure every day, right?
Thank you for coming.
Yeah,
Happy New
thank
Year.
you.
Happy
And do
New Year.
you go on the state's website, because anything that's Nashua specific, that's Nashua specific, because it's by addresses, right?
It is, and
Yeah.
so I do go on that site,
Okay.
so, and I'll keep checking that.
Yeah.
Alright.
And
Thank you.
keep coming to the,
Yeah.
and keep coming to the meetings.
Yeah, okay,
And
thank
where's
you.
your sister? Went?
You know what, she's gonna do as well as she can do.
I'm looking for a
It's not-
motion to adjourn.
Not our control.
Right, yeah.
Thank you.
Thank you.
So moved. But
Go ahead.
Dr. Soros, before you shut the camera, you know,
No
this
problem.
week, I just want to point something out. This week, most of what we had were reports that were screen shared. And so people could sort of follow along. I imagine next week, after the presentation of the data by the staff, there'll be a lot of discussion. And I think what would be very helpful, just as we get more and more facile with the technology, is if people, it's distracting, but if people could direct their remarks to the camera, like you're looking now at the camera, but sometimes when you were talking, you turn to talk to Bobby or to Chuck, and for some reason, it's not picking up your voice with clarity.
I understand.
Yeah.
And then the other thing is that there's a chair that's been, that's cutting you in half for much of the meeting. So, well, right now I'm looking at the lockers again, so I can't really tell. But just to be mindful of the fact that that maybe any other chairs that are not being used could be slid back, because I just want to make sure that the people that are kind enough to take the time to come to our meetings, see that right now, your head, half of your body is covered by, it just moved
That there
again.
make me look slimmer, Stephanie.
Yes, well, you know, it's
To
an
the tip, I'll make
interesting.
sure we move the chair.
Yeah.
Bobby was
Thanks,
supposed to sit here, but she bailed out on me.
Okay, well, thank you for all your hard work, everyone.
All right.
Bye,
thank
staff.
you.
We're officially
Bye.
adjourned. Okay, see you next Wednesday.